Hello, my name is Ann Rhodes. I'm a registered dietitian. Today I'm going to be talking about nutrition and hydration. Nutrition is an exciting field of study that is also a very practical area of healthcare. You have all heard the saying, you are what you eat, and this is also true of the people we take care of. But what exactly is nutrition? It is the process by which the body takes in food for growth and repair and uses it to maintain or improve health. It is a process because being well nourished is ongoing, not just a pill once a day or occasionally eating well. Our bodies are like machines, and the food we eat is what keeps the machines going. What is it we need to be eating to be well nourished? We talk about nutrients that we need to be considered healthy. There are well over 50 nutrients, and more are being identified yearly as our knowledge of medicine and wellness improves. These nutrients are typically divided into 6 groups, called essential nutrients. Essential means that the nutrients have to be taken on a consistent basis, that the body cannot produce them by itself. These nutrients are proteins, carbohydrates, fats, minerals, vitamins, and water. Protein is needed for growth and repair of tissues. Protein helps keep bones, muscles, and cells strong and are necessary in the healing of wounds. Protein can be found in a variety of foods, but the main source of protein in American diets are animal products such as meat, poultry, fish, milk, eggs, cheese, and other dairy products. Proteins are also found in beans and legumes, as well as breads, vegetables, and soy products. Carbohydrates are needed for energy. They are also needed to keep the brain running. Carbohydrates are divided into 2 groups, called complex and simple carbohydrates. Simple carbohydrates are sugars such as honey, jelly, table sugar, juice, soda, and candy. And complex carbohydrates include breads, cereals, grains, pastas, fruits, and vegetables. A majority of our diet should come from carbohydrates. Fats are also needed in the diet. Fats provide energy to our body and give us a sense of fullness. Some fats are better for people than others, and some, especially saturated fats, are often restricted in people's diets. Butter, oil, margarine, cream, cheese, salad dressings, meats all contain fats. While we need fat, we need very little of it and can get it in the foods we eat without adding any butter or oils. On the other hand, fats are what make the diet taste good. They add flavor, and so we do need a little fat. Minerals help build body tissues and are needed for metabolism and other body functions. Minerals are found in a variety of foods, and generally very little of each one is needed each day. The main minerals we need include calcium, chloride, magnesium, phosphorus, potassium, and sodium. Taking too much of one mineral can alter the effect or needs of another mineral, so it is best not to be taking mineral supplements without a doctor's okay. Vitamins also help to regulate body processes and can help the body resist disease. Vitamins can either be fat-soluble or water-soluble. Generally, the water-soluble vitamins are not stored in large amounts in the body, so they're needed daily. But fat-soluble vitamins are stored in the fat areas of our bodies. Vitamins also can be taken in excess, and you should be checked with a physician before taking any doses of vitamins. Water is the last nutrient group. Water is essential to live. One can live several weeks without food, but usually only several days without water. Water is found in all foods. Generally, when we talk about water or fluids, we're thinking of the items that we drink or eat, not what's actually in a food. When you are caring for clients, it will be very important to be offering water or other beverages to them frequently. And you'll probably need to be asking them, would you like something to drink? Or even saying, here's something to drink, rather than giving them the option to say no. How do we make sure that our clients are getting all the nutrients they need or in the correct amounts? We have 2 simple tools that can help with this. They are the Food Guide Pyramid and the Dietary Guidelines for Americans. You can find a copy of the Food Guide Pyramid in the nutrition section of your student manual. Starting at the bottom of the pyramid are the breads, cereal, pasta, grains, rice group, foods that are often referred to as starches. And this is to be the basis of the diet. 6 to 11 servings a day should be provided. This is roughly 2 to 3 servings a meal, and then snacks can be put in between as needed. A serving is usually a slice of bread or half a cup of grain or pasta. And obviously, a 6-year-old or a little lady who's 5 feet tall would be needing the lesser amount of servings, and a football player would be needing more servings. That's why there's the large range. The next level is the fruit group and the vegetable group. And 2 to 4 servings of fruit and 3 to 5 servings of vegetable a day is what's recommended. A serving of both of these is generally considered to be half a cup of canned or cooked fruit or vegetable, or an apple, an orange, half a cup of berries, something like that. These are the 2 groups that Americans generally fall short on. They are, however, the groups that are high in vitamins and minerals, low in fat and in calories, and they really need to be encouraged. If someone's hungry between meals, instead of saying, do you want a candy bar, it might be better off to say, how about an apple, or have a piece of fruit. The next level are the dairy products, which you need 2 to 3 servings a day, and the protein foods, which is also 2 to 3 servings a day. A serving of meat is generally considered to be 2 to 3 ounces. And a rule of thumb of that would be, if you look at the palm of your hand, what the palm of your hand is would be about 3 ounces. And about the thickness of your hand also. And generally Americans eat twice as much protein as they need. However, with ill people or a lot of the clients that we may be dealing with, it's often difficult to get protein in, so we may be needing to encourage foods for ill people, whereas healthy people generally, you might need to say, you don't need quite that much. The top of the pyramid are the fats, oils, and sweets, and these are to be used sparingly. Unfortunately, in the American diet, this is usually the largest food group. If your client is on a special diet, then some of these serving recommendations will probably be altered, and you'll need to follow the specific guidelines for that diet. The other tool for helping determine if one is well nourished is the Dietary Guidelines for Americans, which was developed jointly by the Department of Health and Human Services and the Department of Agriculture. These guidelines have been published for over 20 years and are updated frequently. These latest guidelines were revised in May of 2000, and they incorporate not just healthy eating, but healthy lifestyle. There are 9 guidelines, and they are as follows. 1, to aim for a healthy weight. And what we mean by aiming for a healthy weight is that you want slow weight loss or a slow weight gain rather than rapid loss and gains. It's not very healthy to be what's called yo-yo weighting, going up and down consistently. Number 2, to be physically active each day. And you'll be wanting to encourage your clients in this. And physically active may be as simple as walking from the bed to the kitchen to eat a meal, or getting oneself dressed, or it may be a rigorous exercise program, depending on your client's needs and abilities. Number 3 is let the food guide pyramid guide your choices. Follow the basic plan of foods from each group in the appropriate amounts. Number 4, choose a variety of foods daily. This is very important as each food has different nutrients in them. And you would not want to eat green beans twice a day, every day, and consider, oh, I'm getting enough of my vegetables, because you'd be missing the nutrients that would be found in carrots or spinach or other foods. Variety is very important in what you eat. Number 5 is keep food safe to eat. This will also be an area of major concern for you, especially if you're working in home health. You need to make sure that perishable foods are kept in the refrigerator. that foods are heated thoroughly before eating and are not kept out at room temperature for more than 2 hours. If you have a client that has a dinner, some meat and vegetables, and they're going to eat it over a 3 or 4 hour period, you need to suggest that when they're done eating, they put it in the refrigerator and then reheat it when they're ready to eat again, not just keep it out. Number 6, choose a diet that's low in saturated fat and cholesterol and moderate in total fat. This is generally important for everyone, especially as Americans tend to eat high-fat foods. But if we have a client that has no appetite or needs to gain weight, we may need to not consider the fats as much as we're considering just getting them to eat. Number 7, choose beverages and foods to limit your intake of sugars. Encourage water or 100% fruit juices instead of Kool-Aid or punches. Choosing sugar-free products such as diet soda or diet jellos may also be a good option. Choose foods and prepare foods with less salt. Encourage your clients not to salt their food before they taste it, or to even choose lower salt products. And lastly, if you drink alcohol, do so in moderation. If you're interested in more details of these guidelines, they can be found on the internet. Just look up Dietary Guidelines for Americans and there'll be several different sites. As part of your job, you will also need to be assessing your clients visually to help determine if they're in good nutritional health. Signs to look for include shiny hair, clean, healthy-looking skin, a well-developed body, and by that we mean skin should not be hanging on someone and every rib should not be able to be seen. On the other hand, they should not be bloated or very heavy. If you notice that someone's hair is becoming dull or brittle, or if their skin is getting blotchy or has a funny color to it, these could be signs of poor nutrition and should be pointed out to your supervisor or nurse. Your clients should be alert and attentive and have a pleasant disposition. They should have healthy sleep patterns. An example of this would be that they should be able to sleep several hours at a time and also be able to be awake several hours at a time, not just be taking cat naps all day long. Regular bowel habits are also a good indicator of proper nutrition. You need to remember that every person's regular bowel habits are a little different, and you need to determine what is normal for that person before you're able to say that something is abnormal. And lastly, a client's body weight should be appropriate for their height. Changes in any of these areas can be indicators of a change in a person's nutritional status and need to be brought to the nurse's or doctor's attention. To understand nutrition and feeding people, it helps to have some idea of the digestive process. And we'll have a quick overview of this right now. The gastrointestinal or GI tract is a flexible muscular tube that's about 26 feet long from the mouth to the anus. The purpose of the GI tract and digestion is to ingest or consume food that we eat, to break it down into the components the bodies can use, which are the essential nutrients. Then the body absorbs these nutrients to build and repair, and it will excrete the unused products. Digestion starts in the mouth, where we ingest our food. We need our mouths, teeth, saliva, and tongues in order to chew and mash the food up and get it ready to move down the esophagus. If any areas, if your mouth's not working right, if your tongue is partially paralyzed, if you're not producing enough saliva, any of these can affect the digestion process and affect how one eats or whether they're able to eat. Digestion, which is breaking the food down, actually starts in the mouth with the saliva. The saliva starts breaking the food down into the chemical components. The esophagus carries the food to the stomach, where it is further broken down by acids, enzymes, and water. The gallbladder, liver, and pancreas all play a major role in this. Food products begin to be absorbed in the small intestine. moves from the stomach down to the small intestine. Nutrients are then transported in the bloodstream where they're carried to the parts of the body where they're needed. In the large intestine, a majority of the water is reabsorbed into the body, and the material that the body cannot digest is consolidated and turned into the waste product called feces. The feces then moves to the rectum where it's held until a person chooses to have a bowel movement, where it is then excreted through the anus. Anywhere along the digestive tract and anywhere in the process, something can go wrong, and that can lead to diseases, swallowing, or digestive problems that will need to be treated. If you have a client that has any of these problems, you will be notified of that and told how specifically to deal with each of these things. Some of them will be discussed in further tapes. Some digestive problems or diseases can be corrected or helped with special diets. Special diets can be thought of in two categories. They can either have consistency changes, changing the texture of the food, or what we call therapeutic changes, which may be changing the amount of calories or the amount of specific nutrients in the diet. A diet where a client can have any food in any consistency they desire is called a general or a regular or sometimes a house diet. This diet should provide all the food a client needs in the amounts that are adequate to maintain an appropriate weight. There are special diets that are sometimes called therapeutic diets that may need to be followed. And these can be either consistency changes that might be used if there are swallowing or chewing problems, or if the esophagus is not working properly. Pureed consistency is where all the foods are like mashed potatoes or applesauce. And they need to be very smooth. Often people with swallowing problems have trouble if there's any little lumps or if they can feel the texture with their tongue. It might become difficult for them to swallow. And often this happens if a person has had a stroke, or if they have problems with their esophagus, or there may be some other chewing or swallowing problems that have caused this. Usually when a client is on a pureed diet, you need to be watching them carefully when they eat to ensure that they don't choke or aspirate the food. You would not want to set up their food tray and leave them in a room by themselves to eat. You need to stay with them. Sometimes when someone has trouble chewing, it might be that their dentures don't fit, or maybe they don't have all their teeth, or it could even be just that they're weak and don't have the energy to chew regular food, especially meats. Then they need what's called a mechanical soft diet, or sometimes it's just called mechanically altered. This is typically where the meats are ground up or chopped very finely, and other foods are chopped or cut up finely. Often you can think of when a child's first going from baby food to regular table food, how you prepare that food. That's frequently kind of the texture that we're looking for. Another consistency change is altering the liquids. Frequently, thin liquids are very difficult for a person to control if their tongues are slightly paralyzed or if they've had a stroke. And the liquids need to be thickened to give them better control. Liquids can be thickened to typically 3 consistencies. Nectar consistency, which if you think of pear nectar or tomato juice, it's just a little thicker than regular food. Honey consistency, if you think of pouring honey and how slow that is, kind of like molasses. Or pudding consistency, which is very thick. And thickeners are generally commercial products. They can either be a powder or sometimes they're actually a liquid, and they're added to your liquid and you stir them up to the proper consistency. And you will be instructed either at the institution you're working at or if you're in home health. Each of the containers has specific instructions on them, so it's very easy to follow. What's important to remember is that every liquid has to be thickened. Both beverages, soups, frequently even Jell-O. If a person's favorite food item is Jell-O, it would need to be made with the thickener so that when it's in a person's mouth, it's not turning into a thin liquid consistency. And have to remember that liquids that are taken to brush someone's teeth or to take pills also have to be thickened. And often people who are on thickened liquids have to be reminded frequently, no, you can't take a drink out of the drinking fountain. You need to have that thickened first. Another type of dietary change is to alter the calories given, either by restricting the calories for weight loss or adding extra calories, trying to get some weight gain, or adding extra protein if someone has some open areas or some wounds that need to be healed. And this can become a great challenge if a client has no appetite or has a fear of eating for any reason. You have to become very creative in how you're going to get the food into them. And it can take quite a lot of energy and a lot of thought to get that food in them. Frequently, the best way is giving small amounts of food frequently. Changing the type or amount of nutrients in one's diet is another type of therapeutic diet. A person with high blood pressure or problems retaining fluid may need to have their sodium or salt restricted. If someone has diabetes, their diet is a major part of their treatment, as is anyone with renal or kidney disease. If you are to prepare food or to give food to a client who has a special diet and you do not understand what the restrictions are, you need to ask. Ask the nurse or the dietitian, or often a family member would know what the restrictions are. Don't be afraid to ask. A diabetic diet generally has specific amounts of food to be given at each meal, and the sweets and sugars are limited. If a person with diabetes doesn't eat a meal, it's important to let the nurse know, because their medications are based on how much food they've eaten. If a client asks for food that are not allowed on their diet, you need to remind them of their restrictions. And if they're insistent that they want that food anyway, I don't care if I'm on a low-salt diet, I still want to eat that ham, or I want to have salt to shake on the food, let the nurse know. They do have the right to take the salt if they want it, but you really need to be encouraging them to follow the diet first. Fluids may also need to be restricted. You would then need to be responsible for measuring all the liquids the client is given and to keep a written record of how much liquid is drunk. And it's important to keep it written. You may think, oh, I'm going to remember that they had half a glass of orange juice and they had milk on their cereal for breakfast. But halfway through the day, when you've done numerous other things, you're not going to remember what each person has drunk. So it's very important to write that down. And again, you need to include liquids that aren't necessarily beverages: ice cream, Jell-O, soup. Anything that's liquid at room temperature would be considered a fluid that you would need to be keeping track of for a fluid restriction. And again, with fluid restrictions, most of your clients will not want to be following them. And they'll say, oh, I'm thirsty, can I just have a little water? And if they're very insistent, you'd need to ask the nurse or the dietitian if it's okay to give them more. Food allergies can also affect a client's diet. You need to make sure that you're aware of any allergies and what happens to a person if they would get that particular food item. With known food allergies, it's very important to read labels. If someone's allergic to peanuts, you need to make sure that there are not any peanuts in a particular food item. If someone brings food to your client, say if they brought banana bread, best to ask, does that have nuts in it, if they're allergic to nuts? When in doubt, the best thing is to avoid a food if you're not sure what's in it, if a resident has an allergy. And food allergy symptoms can vary from very mild, oh, I get a runny nose or I get a slight headache, to very severe, such as breathing problems or anaphylactic shock. There have been instances of people who actually die from getting a food they're not supposed to have. So it is very important to make sure both to know what the allergy is and what kind of symptoms they are. And you may also run across a client who's allergic. I'm allergic to shrimp, but I want to eat it anyway. Yes, I know I'll end up vomiting, but I want it. And that, again, you need to say, I cannot give it to you. and let the nurse handle it, or if you're in home health, let a family member handle that. Nutritional supplements are used when food alone is not enough to meet a client's nutritional needs. The supplements can be a commercially prepared product, such as a milkshake type beverage, or they can be an item that's homemade or prepared yourself. This type of item would typically have a recipe that you'd be following. So you may be adding powdered milk to mashed potatoes, or adding extra butter or cheese to something to give more protein and more calories. Or a very common product is something called super cereal, where you're adding powdered milk and extra sugar and sometimes condensed milk to hot cereal to give it more protein and more calories. Supplements can also be provided between meals to a resident, to a client. Sometimes they'll want to have it with the meal. It's generally better to give a supplement after the food's been eaten, because you want them to eat the food first. And occasionally meals may need to be supplemented with tube feedings. This will be discussed in another tape. Patients also have certain rights that must be respected when it comes to nutrition and nutrition therapy. These rights include the right to be served food according to one's ethnic, cultural, or religious beliefs. This means that you need to ask a client if there are certain foods that they avoid or foods that they desire or expect. If you have someone that's from a foreign country, you might need to find out, well, what do you typically eat for breakfast? And prepare those items for them, or find out what foods go against their religious beliefs. Patients also have the right to be served foods according to their personal preferences. If a client does not like peaches, offer them something different. Patients have the right to be served attractive, tasty food at correct temperatures. Patients have the right to participate in traditional holiday meals. If you work in any institution, you'll find that the menus will reflect the holidays. If you're preparing meals for a client at home, you need to ask them what they want on special days. And patients have the right to choose not to follow a recommended dietary restriction after being informed of the consequences. And it is important, though, that the client understand the reason that they're to follow the restrictions and what could happen if they don't. Many factors can affect a client's nutritional status and nutritional needs. These will be discussed in more detail in a later lesson, but are worth mentioning here. A person's age can affect what they want to eat, as well as what their nutritional needs might be. You would expect a 6-year-old to want different foods from a 60-year-old. A person's culture and religion will also affect what they eat, and often the types of meals that they desire. Many farmers eat their main meals at noon and have large breakfasts, while others prefer to have big meals in the evening. People who follow different religions might avoid certain foods. Both Jewish and Muslim people typically avoid pork products. Seventh-day Adventists often are vegetarians or don't take caffeinated products. As a caregiver, we need to know what is acceptable or what is to be avoided with our particular clients. Finances will also play a big role in the food that a person chooses, especially if they're living at home. This can also affect whether a special diet is followed or not followed. Health will also affect how a person eats. If someone is in pain or if they're feeling nauseated, they're not going to want to eat. Someone with breathing problems or who is weak may not be able to stand up long enough to prepare a meal and then have the energy or the breath to eat the food. And lastly, personal preferences play a huge role in the foods chosen to be eaten, or whether people eat, or what times they eat. All these factors need to be considered when assisting a person in either eating or preparing their meals. Fluids are another aspect of nutritional care that we need to take into consideration. The average person needs about 2 quarts of fluid a day. This includes water, milk, juices, sodas, Kool-Aids, but generally caffeinated beverages are not included in that 2 quarts. And that is because caffeine acts as a diuretic. It will pull water out of you, so it's sort of defeating the purpose of, of getting the fluid in. However, if a person is on a fluid restriction, you need to include every fluid, whether it's caffeinated or not. When looking at fluids, we consider what's called fluid balance, and that means that the amount of liquid taken in needs to equal the amount that's expelled. Fluids are expelled in urine, in sweating, and in breathing. Normally, our bodies regulate our fluid balance automatically. If we drink more liquids, we'll end up urinating more. If it's hot outside and we're sweating a lot, we typically feel thirsty, so we drink more. Or if we're not drinking more, we'll produce less urine. Our bodies typically will do that automatically. But with some disease processes, that doesn't happen, or sometimes medications we're taking may alter that fluid balance, or someone just may not be drinking, and they're just not drinking enough, but they're still putting some urine output on. And that's where you might run into fluid balance problems. And those two problems are dehydration and edema. Dehydration is when a person is expelling more than they're taking in. If a person has a fever, or if they're sweating a lot, or if they're not drinking as much as they normally are, they might get dehydrated. Some symptoms of dehydration are a very dark colored urine, dry cracked lips, and dry flaky skin. Or if a person, normally someone that you're taking care of, if you notice that they're suddenly urinating a lot less than normal, that can also be a sign of dehydration. Often a person, especially an elderly person, will get confused when they're dehydrated. And that frequently can be a sign, oh gosh, someone is saying silly things or acting more confused than normal. You might immediately want to check, have they been drinking enough? Or when they go to the bathroom, check the color of their urine to see if it's really dark. And edema is the opposite of dehydration. It's an excess of fluid. The most common site of edema in the body you'll find in the legs, ankles, and feet. But edema can be found anywhere in the body. Edema is usually seen if people have heart or circulation problems. And with edema, a person might be placed on a fluid restriction. If you have a client on a fluid restriction, you need to keep a record of all the fluids they consume. You'll need to ask them what they drank prior to your coming to their home, or if they had a drink of water when they were in the bathroom, or just anytime you need to be checking on their fluid intake throughout the day. Remind them that the water they drink while they're brushing their teeth needs to be counted as fluid. The role of the caregiver in nutritional care includes assessing whether a client is eating balanced meals. This can be accomplished by observing what they eat while you are with them, asking them what they ate before you came, or what they're planning on eating after you leave. You'll also need to be assessing the quality of the foods that they're eating. You can do that with using the food guide pyramid or with the dietary guidelines for Americans. You wouldn't want a client who's eating a bowl of cereal 3 times a day, and that's all they're eating. You'd need to be encouraging them, or maybe even saying, well, let me fix something else for you. You could sometimes tell, if you're working in home health, that there might be a problem with nutrition if you look in their refrigerator and there's nothing in there, or if there's no food in their cupboards, then you know that there may be a problem. You also need to determine whether they're eating enough food. Are they losing weight? Do they have enough energy to function during the day? If they have wounds, are the wounds healing? All of these things will be affected by their nutritional status. And as a caregiver, one of your jobs will be in helping your clients follow their prescribed diets and encouraging them to make good food choices. If you are uncertain as to what their restrictions are, again, you need to ask. Ask the nurse, or if a dietitian is available, or a family member, to make sure that they're eating what they should be. You also need to report to your supervisor or nurse any problems that you notice. You might notice that someone's suddenly having problems swallowing or chewing. If someone takes a bite of food and chews and chews and chews and then spits it out, maybe their dentures don't fit right, or find out what is happening. Those are items that you need to mention to the nurse. If someone's vomiting, or if suddenly they're always thirsty, or if they're refusing to eat when that has not been a pattern of theirs in the past. Those are things that you need to let your supervisor know. As the hands-on caregiver, you are the eyes and ears to all of the other healthcare providers. They really rely on the information that you're able to give them. We've covered quite a bit of information in the last half hour. You should now have a better understanding of what a good diet includes and what to watch for in your clients to help determine if they're getting enough to eat or if there might be some nutritional problems. Good luck in the rest of your program and in your new careers.